You are on live, sir.
Hello, Mr. Chiranjeevi. Can you hear me? Hello?
Yes, sir, I can hear you. Yes.
Yeah, this is our principal, sir.
Namaste, sir. Namaste, sir. Bonara, sir.
Now the session is over to Vasu, sir.
Thank Thank you, Dr. Raju. A very good morning to all. Welcome back to the day 4 of the webinar, international webinar. So on behalf of Sri Vishnu College of Pharmacy, I, Venkata Srinivas Jaska, Organizing Secretary, and Dr. Raju, the Program Coordinator for the event, would like to welcome today's speaker, Mr. Chiranjeevi Tupakala, is a pharmacy manager working for Safedale Pharmacy, London, UK. And our director, sir, Dr. Kumar V.S. Namani, Sri Vishnu College of Pharmacy. And Dr. K. Prasad, Principal, Sri Vishnu College of Pharmacy. And all the pharma fraternity and also the participants. Welcome to the day 4 of 1 week online international webinar on the role of pharmacists in healthcare. So with this small welcome, I would like to introduce our director and principal to the gathering. Our director, Dr. Kumar V.S. Namani, has taken his duties from 2018 as director of Sri Vishnu College of Pharmacy. He has been holding B.Pharm and M.Pharm from Andhra University and has completed PhD from Naipur, Mohali. Subsequently, he did his postdoctoral fellowship from McGill University, Montreal, Canada. In addition to that, he has an overall experience of industry research for over 14 years on drug discovery and development and managerial experience. With regards to our principal, sir, Dr. K. Prasad has completed his B.Pharm, M.Pharm, and PhD in Andhra University Visakhapatnam. We've worked in various teaching designations and as a professor in HKE College, Gulbarga. Now, serving as a principal of our college since 2011. He has wide research experience and several DBT AICTE research grants to his credit. Now, I would request our Dr. Kumar V.S. Namani, Director, Sri Vishnu College of Pharmacy, to give a welcome note. Over to you, sir.
Yeah. Greetings to everyone and welcome to day 4 of international webinar on role of pharmacist in healthcare. I am very delighted to see the number of registrants that we are getting and in terms of the number of feedbacks that we are getting and the number of views on the YouTube. These numbers are really encouraging and stimulating us to conduct the webinars in a sequence. And today's one is the third FDP and the fourth one is already planned and which is in circulation. And hope all of you register and participate in the same way that is happening over the past 3 FDPs. So on this note, I really glad and welcome you all on behalf of the Sri Vishnu Society Management, Chairman Sir, Sri Vishnu Raju Garu, Vice Chairman, Sri Rajchandran Rajagopal Garu, Principal Dr. K. Prasad, and all the staff of SVCP. Welcome you all for this webinar series. And today's speaker, as you see, is in the picture, is Chiranjeevi Tupakala. He is from UK and is a community pharmacist and working at NHS, National Services. I think it's one of the best the healthcare policy in the world, and the country is community pharmacist wise from a government sector point of view. I would say without any hesitation that is one of the best practices. As today's speaker is part of that system and is practicing the job. And I welcome Chiranjeevi Garu for this webinar. And I really thank you for accepting this invitation. I also must add one point about Mr. Chiranjeevi is that he's alumni of this college. So now I think he's now a director, a living example to all of you that what one can become after graduating from a college like Sri Vishnu College of Pharmacy. So at this note, not only I'm thanking him and requesting to share his knowledge and wisdom with all the faculty as well as the students that are present for this webinar series. So I also thank all the principals and the senior staff of all other colleges who are continuously motivating their own students and the other colleagues to participate in this webinar series. So once again, I welcome you all for this webinar series and looking forward for a good interaction with today's speaker and honest feedback and looking forward for your suggestions to organize more events like this in the future. So the next one, the webinar which is starting from Monday is on innovations in natural product driven drug discovery and analytical chemistry. So I request all of you to interested in the natural product research and in analytical chemistry to join this webinar as well. So on this good note, I welcome you all once again and looking forward for active participation. So over to Srinivas.
Thank you, sir. Bhadraju, sir. Okay, so welcome to the day 4 for the role of community pharmacist in NHS. Today's title would be delivered by our speaker for today is Mr. Chiranjeevi Tupakala, Pharmacy Manager at Safedale Pharmacy, London, UK. With regards to his education, he has completed his Bachelor of Pharmacy from Sri Vishnu College of Pharmacy from 2002 until 2006, following which he has done his Masters in Pharmacology from University of Hertfordshire, UK in 2007 until 2008. After which he has been working for a while as a pharmacy technician and completed his Overseas Pharmacist Assessment course from University of Brighton, UK in 2012 and 13. He is a member of Royal Pharmaceutical Society, UK, and also registered pharmacist with the General Pharmaceutical Council. With regards to his experience, he started his career as a pharmacy technician, working for Safedale Pharmacy and also for North Middlesex University Hospital. Later, he did his pre-registration pharmacist with Safedale Pharmacy and also worked as a locum pharmacist in London for about 1 year, after which he has been promoted as a pharmacy manager for Safedale Pharmacy, London. And since 2015, he is working as a pharmacy manager. So this is with this short introduction about the speaker. Now I would like Mr. Chiranjeevi to continue with his topic. Thank you. Over to you, Mr. Chiranjeevi. Please unmute the mic.
Good morning, all. It's good morning to you, and it is very good morning to me. It is 6 a.m. in UK time, and I'm very happy to participate in this webinar. See, one of the reasons is I studied in SVCP, and participating in a live webinar with SVCP is like participating in a family group. Okay, before I start, I would like to thank few people who gave the opportunity to me speak today. So I would like to thank Dr. Kumar Nemanani sir, who is the director of SVCP. And I would like to thank Dr. K. Prasad sir, who is the principal of SVCP, and Dr. Babu Raju, who is the program coordinator, and the Dr. And then Mr. Venkata Srinivas sir, who is organizing secretary. Thank you very much to these 4 people who gave me the opportunity to talk about my current profession. Okay, so today the topic is the role of a community pharmacist in UK. So before, I just like to give a little overview of what I'm going to talk about today. So today I'm just going to talk briefly about what is NHS. And then in the part of the NHS where pharmacists work. And then later on, I'm going to my role, which is a community pharmacist role. I'm going to talk in-depth details about community pharmacist role, which includes day-to-day activities. So community pharmacist role involves, which includes administrator role as well. As a manager, you have some administration role. So I'm going to talk about the clinical aspects of a pharmacist, daily routine, as well as the managerial role. And then I give a little information about a hospital pharmacist on their specialties. And then later on, I will tell you what is the brief process you need to go through to register as a pharmacist in the UK. And then I think this is the exciting topic for everyone. Pharmacist career options. I will talk about the money bit as well. Don't worry. Okay, so let's talk about the NHS first. So NHS was established in 1948. So in simple terms, what is NHS? So NHS is a government organization to run healthcare system in UK. So they named it as a National Health Services. Also, in simple terms, you say that it is a government sector of healthcare system, but they just named it as a National Health Services. So we shortly called NHS. So it was established in 1948 after the Second World War. And if anyone want to ask the questions, why 1948? I'm very sorry, I don't know the reason. Why after Second World War? Probably they just took that decision after the World War. It's 1948, they was established. And every citizen of Britain and the government feels it is an achievement. It is 70 years plus. The organization is constantly growing and it is successfully delivering healthcare needs to the local population. And it is a very complex system. When it started, it was a very, very simple system. Now it is very complex. Even it's difficult for me to understand all aspects of NHS. So how does this NHS get funding? We pay taxes to the government, and from the taxes, the government runs NHS, National Health Services. So what does NHS do? NHS diagnoses the people conditions and gives the treatment to the people's health conditions, and it supplies the medication. All of them are free without charging anything. So it is a good infrastructure. And to be honest with you, I'm proud to say that I'm part of NHS family. And the next thing is, I just mentioned that the UK is a combination of 4 countries: England, Scotland, Wales, and Northern London. Yeah, I did hear that bit. Someone started saying under the breath, "Sir, we thought it is a topic about healthcare system, but we are talking about the geography." No, hang on. Don't come to the conclusion. So you need to know that UK is the part of 4 different countries, because the reason is NHS is divided into 4 different parts. So NHS England, NHS Scotland, NHS Wales, and NHS Northern Ireland. So I live in England. So my NHS is called NHS England. So I work under NHS England. So NHS is divided into different parts. And the main part is called clinical commissioning groups. In abbreviation, it's called CCGs. So like our India country is divided into different states. In the same manner, the NHS is divided into clinical commissioning groups. Okay. So I work in London. Okay, I work in London, a place called Wandsworth, and I work under NHS Wandsworth Clinical Commission Group. So I hope everyone got this bit. Don't think too much about it. It's just a brief introduction, brush up what I mean by NHS. You don't need to really remember these things, but it's good if you remember it. But however, if you can't remember, don't touch your mind. Okay, so I would like to talk a little bit about CCG. Okay, what is their role in the NHS? Okay, so I told you that the NHS is a very big organization It is a complex organization, and how to run the complex organization. So when you got a big system, obviously to run it, you have to divide it into parts. At the same time, you have to take help from different people. You have to take help from different people to run the complex system. So obviously these NHS gave that responsibility to local CCCs, like, oh, but this is a complex system. I can't handle this myself. Let me hand over to local people. CCC, Wandsworth CCC, can you just look after Wandsworth people, clinical responsibilities, health responsibility, and they give it to the Wandsworth CCC. Like that. And these Wandsworth CCC people, local people, what they do, they take contracts from different people. They approach different people. Hey, can you help me? Hey, can you help me? What's your quotation? Hey, can you help me? But they approach different people to run this complex organization. So what they do, they contact hospital providers to run the hospitals, and they give commission. So the hospital people provide services, and they invoice NHS, and they invoice they invoice CCCs, and the CCCs pay money to them. In the same way that hospitals, one part, and then so you got the community services as well, like me, people like me who work in community pharmacy. So CCCs, they make some contracts with us, and they tell, okay, you do this service to our local people. For your hard work, you have to remember, for your hard work, because I work hard, for your hard work, I pay commission, which I take as a salary. So that is community pharmacy providers, and they also commission to general practitioners. Oh, who are these guys? General practitioners. Who are these guys? So this is the term. If you want to come to UK, you need to remember. GP is not a doctor. So in India, we call everyone doctor. Whether they work in hospital, whether they work in high street, you simply call them doctor. But in UK, it's not like that. If anyone works in hospital without any specialization, they're called doctor. If they got any specialization, we call them consultant. If they work in high street, if they have a big building, and it's not a hospital, it is in a community, in your local areas. You have your house, next to your house, there is a big building where your doctor sits down. When you not well, you go to that building and the doctor diagnoses it. So that doctor is called GP, general practitioner. This is a term you need to remember very well. So during my conversation, for the next slides, I use this word GP, maybe quite frequently. Then you need to connect them to, you need to just think that GP means as a doctor who lives in a community, who deals with the people directly, okay? And he's the primary contact. He's a primary contact of local population. So for me, if I got any health problem, who is my primary contact? My GP is my primary contact. I can't simply walk into hospital. No, they will close the doors. No, it doesn't work like in India. So if the works is, if you got any health complication, initially you make an appointment with your GP, and your GP diagnoses your condition. And then if it is needed, if you think he can't handle your health condition, he would refer you to the hospital consultants. That is the way the healthcare system works in UK. So that's, I think we are getting sidetracked. Come back to the current slide, which is CCC. CCC commission hospital providers to run hospitals. CCC commissions community service people like community pharmacists. CCCs commissions general practitioners who are doctors, and CCCs provides commission to ambulance providers. Okay, I would say that, you know, I'm really amazed by ambulance service in this country. I'm really amazed. And it's very difficult to tell what is the difference between our Indian ambulance services and here. I'm not making our India small, but I'm just saying that the system, how the system is organized in the UK, That is, I feel proud for the ambulance people. The thing is, as a community pharmacist, some of my patients are collapsed in my pharmacy because of their health conditions and the medical conditions. And one example was recently last week, one of my patients got seizures, and she was just collapsed in my pharmacy, and then I had to ring ambulance. And that's it. Within few minutes, we got the ambulance people. Within 2-3 minutes, we got the ambulance people, and the lady was looked after very well. So well, coming back to the topic again. So CCCs provide commission to the ambulance providers and mental health providers. So mental health, why it is important? Mental health, why NHS is commissioned to mental health? In India, we see our local population is suffering with conditions like very common conditions like diabetes and blood pressure. These are very common. Unfortunately, in our country, most of the people suffer with mental health, like depression, other mental health conditions, psychosis. So this kind of condition, we see a significant proportion of people suffering with these conditions. That's the reason NHS pays a lot of attention to mental health providers as well. So they have a separate building, they have a separate sector, they have a separate hospital to deal with the mental health conditions. There you see all specialists to deal with that clinical condition. Okay, and it also gives commissioning to charities, local authorities, and some private sector people. Okay, and one of the organizations which is very important, you just need to remember it, which is NHSBA, which is NHS Business Authority. So these are the people. So this is one of the wing of the NHS who provides money to the local service providers. Okay, so enough about this slide. Shall I move on to the next slide? Okay, someone wave the hand. Yes. I'm going to move to the next slide. So, well, this is our topic. Okay, where do pharmacists work? Hello, Chiranjeevi sir, you told us a lot about NHS. I'm not interested at that bit. I'm interested. I'm a pharmacist. I studied pharmacy. Where should I work in NHS? Well, I'm coming to you. If you qualify as a pharmacist, if you register as a pharmacist, you work in community pharmacy. You got lots of options, my friend. You work in community pharmacy. You can work in hospital pharmacy. You can work in GP practices, sitting next to the GP, making a role like a GP. It is a good opportunity for anyone who wants to become a doctor. How can't become a doctor? It just become a pharmacist like me. I wanted to become a doctor, but couldn't secure good grades. That's why I studied pharmacy. So this is an alternate option for anyone who wants to become a doctor for some reason, for an unfortunate situation. If you can't become a doctor, you can become a pharmacist and work like a doctor. You are just holding the title as a pharmacist, but your roles and responsibilities and the respect you get from the community is exactly like a doctor. So you can work in GP practices as well. Okay, and you can work in CCCs. You can work in care homes. You can work in urgent and emergency care. What is urgent and emergency care? So in a hospital, you have different wings, different parts of the hospital. One of the important part is A&E, accidents and emergency. What is A&E stands for? Accidents, emergency. So suppose if you broke your hand, you need immediate attention of medical attention. You go to A&E. You had an accident, you go to A&E. You banged your head, you go to A&E. You got a constant persistent scout. You can't get medical appointment with the GP. Then you go to urgent and emergency care. Okay. So in a hospital, you got A&E department, accident emergency, you got urgent care department. Urgent care department is just in simple. It is urgent, but however, it is not like life-threatening condition. Okay. So pharmacists can work in urgent and emergency care department as well. And the pharmacists also work in royal military, in a royal military. Okay, what they do in the military? Okay, do they kill people with medication? Opposite war people? No, we don't kill people with medication. So you might think that, oh, pharmacist, the soldier might be killing people with a gun and AK-47. Maybe the pharmacist is just throwing the medication into their throat and killing the people. No, 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 it's not that. We have the soldiers who is dedicating their life to your country, who fight for your country. And they have medical conditions as well. So their medical conditions need to be looked after by someone. So who is going to look after their medical conditions? Doctors. And the doctors going to diagnose the medical condition. And they need a pharmacist help to dispense their medication, to counsel their medication, to tell them how to administer their medication. So that is the way the pharmacist works in military as well. Okay. And when they can work in prison, what they do in prison? Well, same principles apply like a military, and the criminals reside in the prison. Government provides food, and we will provide medication to their medical conditions. That's it. That's the reason we work in prison. Okay. And nowadays, NHS is paying a lot of attention to pharmacists. The reason is in NHS, you got a short gap. You have a short gap of, you have shortage of doctors, qualified doctors. You have a shortage of GPs, general practitioners. And when they got this shortage, obviously NHS started looking at people, different people. Who can help? I got shortage. A nurse, can you help me? Hey, you are a pharmacist, can you help me? They started looking at different types of professions in the NHS, and then they identified as pharmacists. They identified us as a pharmacist. They identified, yes, hey, they identified as a pharmacist who can fill the gap of a GP. They identified us. And they said, here, I got the shortage of GPs. Here, I got the shortage of doctors. But I don't need to worry because we have pharmacists in NHS where with a little training, they can fill the role of a doctor. So that is the weight of a pharmacist in your healthcare system. So that is the weight of pharmacists. So NHS believes, and the local population believes, the Great Britain believes, the UK believes that the pharmacist can fill the gap of general practitioners, GPs. So you have to be proud. It's for everyone who is studying in pharmacy. Please be proud, especially this COVID situation. The pharmacist played an important role to deliver people's healthcare needs, and everyone on the street are salute to the pharmacist. You are fabulous. You are amazing guy. You are wonderful. These are the comments I received from my patients because we're in constant touch with the people. We're in constant risk of getting COVID. However, we didn't care. We did our job role. So that's the reason how to be a pharmacist. Okay. Well, so RPSGB, sorry, I forgot to mention what I mean by RPSGB. RPSGB means Royal Pharmaceutical Society of Great Britain. Okay. So they produced a short video about a pharmacist role. I would like to play the video, but I'm not fully confident about our current Zoom, and I was advised by some well-wishers that the Zoom can crash if I play the video. Okay, I'm sure that you people get disappointed if Zoom get crashed, so I'm not going to play it for you for your sake. But however, if anyone's interested, please make a note of that link. If anyone using a mobile phone, do a screenshot, you can remember it. If anyone are not attending the conference in Zoom, just write down with a pen and paper, go to the traditional methods, take it, grab a pen, grab a paper, and write down the link. And in your leisure time, just play the video. I will tell you, after looking at that video, you might get motivated to become a pharmacist, to work as a pharmacist. The video is such a beautiful video. Please watch it. Excuse me. Okay, so we talked about pharmacists and where do they work. The pharmacists work very different parts of the healthcare system. We talked where they're going to work. Then can I talk about myself? That is the reason I'm here. What mean by myself? I'm a community pharmacist. That's why I'd like to talk about community pharmacists. What the community pharmacists do on a daily basis? What they do? I guess most of the listeners are from probably Telugu people. So when you address your profession, always say that I'm working in a pharmacy. Don't say, Mandul shop lo panchestunnanu, medical store lo panchestunnanu. Please don't say those words. So what's the community pharmacy? It's a pharmacy, it's not a medical store. It's the word given to your profession, pharmacy, okay? And don't say yourself that I'm working in like a superstore, I'm working in a D-Mart, I'm working in Reliance supermarket. Don't say that I'm working in Apollo medical store, I'm working in a Hetero medical store. Don't say that. I said it. Pharmacy. What is the difference between a medical store and a pharmacy? What's the difference? You need to understand. Okay, what is a store? Okay, what is a store? Okay, in simple terms, you go to a store, okay, you buy a product, you pay money. There is no more interaction. There is no more interaction. So the maximum interaction, the maximum interaction we have, is this product right product? That's the maximum interaction you can have. If you go to a store, get a product, you just pay money. Your interaction ends with the store person. But if you go to the pharmacy, it's not just I give medication, I take money, put in my pocket, feel proud. No, that is, I'm not feeling proud because I'm getting financial gain. I do a lot more than that. I do a lot more. I give medication to the people. I do a lot more than that. That is the reason I'm proud to be a pharmacist. I'm proud to say that we are pharmacists. I'm proud to say that we work in a pharmacy, not in a medical store. There's a lot more interaction. That's what I'm going to talk about. Hang on, don't get excited. I will tell you everything what I do in a daily life. Okay. First, let's get the titles first. Okay. The first one is dispensing prescriptions, which is obvious thing. That's the reason people come to pharmacy to get medication. Dispensing prescriptions. And then I advise about their minor elements, because in UK, it's very difficult to see a healthcare professional. If you want to see a GP, you need to make an appointment. If you want to go to a hospital, you need to be referred by the GP. Even if you want to see a nurse, you can't see them directly. So pharmacist is the only healthcare profession in the NHS health system who can be approached without any appointment, who is freely available. Pharmacist is the only healthcare profession in UK who can be approached without any appointment, without any prior arrangements. That's the reason you are always in demand. People, if they have a little concern about their medical condition, they try to look at you, pharmacist, and help me. So they approach you. So obviously I see a lot of patients on a daily basis to deal with their minor elements. I will tell you what are those minor elements in a bit. I'll tell you list out. And I recommend them products. And I do medicine usage reviews. I do new medicine services. I do substance misuse surveys. I initiate people monitoring dosage systems, MDS. I'll talk about everything in next few slides. Just try to remember. And I administer vaccines, like different types of vaccines, but mainly in my store, in my pharmacy, I do flu vaccination, pneumonia vaccine, and meningitis. These are 3 vaccines I do. But a pharmacist can do a lot of vaccines. But at my pharmacy, that's what the vaccines I do. I do community pharmacy consultation service. In short, it's called CPS. I'll talk about what it is. And I liaise with my other healthcare professionals. Hey, doctor. Hey, nurse. Hi, I need your help to deal with the patient. Okay, so I liaise with all the healthcare professionals. And these are all the services I talked so far is provided by NHS, because we do the services, we get the payment for the service we do from the NHS. But however, we charge patients and we do some services as well. They are called private services. Why they are called private services? So the services what I listed under private, they are not provided by NHS. So NHS doesn't provide their services as a part of the healthcare system. NHS doesn't provide those services. So, but people need those conditions to be treated, those conditions to be addressed. So, as a pharmacist, a group of pharmacists, we had a meeting. It's like, oh, what can we do? I got a patient who's losing hair. What can I do for him? Oh, I have a heavyweight patient. What can you do for him to lose his weight? So, hey, my patient wants to go to the different country, enjoy the holiday. Especially he wants to go to India, Mumbai, Bangalore. But there's a malaria risk. What can you do? Can't I help him? Can't I help him to enjoy his Indian holiday? So then we thought about, well, NHS can't provide all these services. We have to be realistic. Okay. We start our private services. So I run my private clinics, anti-malaria tablets. If anyone is going to India or any part of the country where there is a risk of malaria, we give some anti-malarial tablets as a prophylaxis. And I deal with erectile dysfunction. So this is NHS doesn't deal with. And I deal with people if they got heavy weight. So because of weight is the cause of many diseases, is a risk factor for many diseases like blood pressure, diabetes, many conditions. It's the risk factor. I need to make sure they lose weight. Okay, I'll provide service to them. Advice, mental advice, how to lose the weight, exercise, eat sensibly, and give medication to lose their weight. And if anyone losing hair, you see that I got good hair because I take medication. I'm joking. It's a joking part. Don't do it. It's a natural. Okay. So if anyone is losing hair, I can provide some medication to stop the losing their hair, like tablets. I can provide some tablets. I can apply some gel to them. I can give some lotion to them to stop hair falling. Okay. Enough said about these slides. Let's go to the next slide. So, okay, dispensing prescription. Okay. So, well, where I came from India, okay, when I go to the pharmacy, all my prescriptions are dispensed by non-qualified professionals. So generic, obviously, if I have a question about their medication, okay, really, they don't have answer. What I had to do, I used to go to my doctor who prescribed the medication. The medication like lollipops, without any packaging, without any label on it, instructions, how to take it, how to read it. So I take it to the doctor and he used to say, hey, this is a red capsule, take in the morning. Hey, it is a blue capsule, take at night time. Night is dark, your capsule is dark, so that's why take at night time. Hey, it's a white capsule, it's a white tablet, take in the afternoon. How you remember? White, bright, afternoon, bright. This is the doctor used to counsel me. I was not getting this help from my local medical store because it was a medical store, not a pharmacy. But in UK, if I dispense medication as per the protocol, as per our standard operating procedures, we have to, when we give out medication, once it's been dispensed, we have to give out this medication to the patient and we have to do a little counseling. We have to counsel about it. We have to give it, we have to address these concerns if they have any concern about the medication. Before I talk about my counseling notes, let me just give a little brief about how the dispensing process works. So we get a prescription from a patient. Okay, we get a prescription for a patient. And then the prescription, we check the legal requirements of the prescription. Like most of the prescriptions are valid for 6 months. So we check the legal aspects of the prescription. Is the date right? Is it still within the date? Or is it expired? First, I check that one. First one, legal legal aspects. One is the date. I check the date of the prescription. Next, is it prescribed by a genuine GP? Is it prescribed by a doctor who's qualified doctor? You can get a fake prescription. Yes, you can get a fake prescription. You get a fake money. It's not easy to get a fake prescription. In UK, sometimes getting fake prescription is more popular than printing a fake money. The reason is, with money you can't buy medication here. You can only get medication from a prescription. So people who want to abuse their medication, they need to print prescription, not money. So printing a fake prescription is a problem. So you need to check the date, and you need to check genuinity of the prescription. Okay, and you need to check the details are right, the patient details are right. Is anything missing? Because in the on the prescription you need to have patient details, or else how will you dispense the prescription? You need the patient details. This makes common sense. Okay, you need the patient name, the full name. You need the patient date of birth. You need the patient where he resides. Okay, you need this information. Okay. So you check the patient details, and then you check. This is the clinical aspect. Sorry, it is the legal aspect of the prescription. Then you move to clinical aspect. So in clinical aspect, what do? You check clinical aspects of like, is the drug, what medical condition they are taking? Is it the right drug for the medical condition? Because when GP prescribes a prescription by mistake, when they're rushing, they can choose wrong drug. It happens. They can choose a wrong drug. Instead of amoxicillin, they can choose amlodipine. Two different medications for two different conditions. There is a possibility. So we need to check, is the patient being prescribed right medication for the right medical condition? That is one thing you have to check. So once you are happy that they got the right medication, and then you need to check the dosage instructions. Okay, obviously you know that elder population, they need different dosing, and the younger or the child, infants, they have different doses. So we need to check, is the dosage is appropriate? And then you need to choose, you need to check. The patient is, if there's an elder patient, and if they're taking different sort of medication for their regular conditions, like long-term conditions like diabetes and blood pressure, they take a lot of medication. So you need to check the current medication, is it interacting with the medication prescribed just now, is it interacting with the rest of the medication? You need to check. So you have to check these clinical aspects. Well, we just summarize what we discussed now. Well, so when you get a prescription as a community pharmacist, you have to do two things. You have to check legal aspects of the prescription. Two, you have to check the clinical aspects of the prescription. The legal aspect is the date, the patient details, and genuinity of the prescription, and then expiry date. And the clinical aspect is right drug, right dose, any interactions. I'm happy. Now I'm happy with the prescription. The next process is, yes, this prescription, I'm happy to dispense it. Then I will hand over that to a technician, pharmacy technician. Hey, technician, can you please dispense this prescription, please? And the technician dispenses the prescription. Okay, so they enter on the PMR, patient medical record. They generate a label, instructions label. They stick on the bottle. Okay, and then they hand over that back to you. Hey, Mr. Pharmacist, I did what you want me to do. You gave the prescription. I dispensed it. Can you check accuracy? Can you do accuracy checking, please? So what is accuracy checking? Once I get finished prescription, finished medication from my technician, I check. Did my technician dispense the right medication as per the prescription? One. Did they copy the right dosage instructions? Okay. Did they enter the prescription in the right patient PMO? I check. And is the product they supplied, is it within the date? It means, is it expired? Is it within the date? I do this accuracy checking. Once I'm happy that the prescription is the medication is accurate, then I'll go out to hand over the prescription to my patient. So what I do, I'll just quickly summarize again. Okay, well, once I get the prescription, I check legal validity and the clinical aspect, and then I do accuracy checking. Now I'm happy, I hand over my prescription to my patient. When I hand over the prescription, based on their, based on the medication, I do some counseling. I talk about this one. Okay, I have given 3 examples. There are lots of examples, but I have given 3 counseling examples. Okay, let's say many people might know nitrofurantoin. It is very popular antibiotic in my practice. It's a nitrofurantoin. It is used for urinary tract infections, UTI, urinary tract infections. So when I get this medication, this is a very good antibiotic. I have seen that it treats urinary tract infections very well compared with the other antibiotics like trimethoprim, cephalexin. Compared with those 2, I would say this is a superior. This is superior antibiotic. It treats the condition, lovely, excellent. It kills the bacteria, simply. So, but there is a little problem. The problem is this capsule gives, has to be taken after food, okay? Next, it has some funny side effects. The funny side effects, it makes your body fluids yellowish. It makes the body fluids yellowish. So it means that if you go to the urine, you suddenly see dark yellow urine. If you go for your stools can be darker than usual. So anyone, so obviously the patient may be bewildered. Oh my God, what type of medication I'm taking? It is changing my whole system. They get this anxiety and panic. Some people get panic. Oh my God, what's happening to me? So as a pharmacist, I give prior warning when I dispense this medication. I go to the patient. Dear patient, this is good antibiotic for urinary tract infections. Okay, it is a 3 days course. Most of the time it is 3 days course. Yeah, occasionally it can be 7 days. If the infection is very severe, it can be 7 days. Most of the time it's 3 days. Dear patient, you got 3 days course of nitrofurantoin antibiotic. Please take this one after food. It can change your body fluids color. Please don't get worried. It is harmless. It is harmless. We expect that. It means if you see that the change in the body fluids color, it means the tablet is working. Do not get panic. Do not get worried. Please keep taking your medication and finish your course. And that's assurance I give to the patient. And the patient can go home, take it peacefully. And so the next example is amoxicillin oral solutions. Okay, so it's for children. Antibiotics, they usually come in a powder form because they can't swallow capsules or they can't swallow tablets. They usually come in a powder form. So as a pharmacist, my responsibility is not me, my technician. What my technicians does, take the powder form of the bottle, take a required quantity of water, add it, shake it, and mix it. So the powder form can be stored at the room temperature. You don't need to take any special precautions. You just keep at the room temperature. But once it is mixed as water, when it becomes oral liquid, you need to keep that one in the fridge. It has to be stored between 2 to 8 degrees. You store in the fridge. And if you don't mention this to the patient, what would happen? The patient would take this one and they keep in the kitchen cupboard. They store at the room temperature. And in the following day, the medication is expired. And the patient can administer the expired product. 2 disadvantages. One, if it does happen, 2 disadvantages, the medication doesn't work. Okay, their existing clinical condition can be deteriorated. Number 2, sometimes expired medication can induce some unwanted adverse side effects. So there are 2 disadvantages. So it's a simple information that you have to keep the bottle in the fridge. When we dispense medication, it stays on the label, but however, most of the people, they don't read information on the label. They're lazy. They rely on us, they rely on the pharmacists. So this is our responsibility to tell them, hey patient, this is your antibiotic for your child. Please keep in the fridge and finish the course. I have seen in my practice that many people left their antibiotics outside fridge and which are expired and which didn't benefit him. So it's a simple information, but you are a connecting link between the doctors and the patient to provide that information. So you have to be careful. And then the next example is methotrexate, okay, which is commonly used for the autoimmune disorders. Methotrexate dose is weekly dose. They have to take every week on the same day. If you start taking the medication on Monday, they have to take every Monday. They have to take, if they start taking medication on Tuesday, they have to take every Tuesday. If they start taking medication, what is the day? Thursday, they have to take on every Thursday. So if it's very important information you have to mention, and there's a lot of information I probably about methotrexate. I talk about their side effects, what are the side effects they have to watch out. I'm not going into in-depth details because it's too much information for you guys. Okay, and how to manage their side effects, methotrexate inducer side effects. When you take methotrexate, it can induce some side effects. How to counteract these inducer side effects by taking some other medication. So I'm not going to in-depth details. Okay, let's summarize this slide. So counseling examples, nitrofurantoin, okay, it's an antibiotic to treat urinary tract infections. You have to take that one after food. It can change color of the body fluids. Do not worry, it is harmless, and you finish the course. So amoxicillin oral solution, it comes in powder form. Once it is mixed, it has to be stored in the fridge and finish the course. And the methotrexate, and used for the autoimmune disorders, and the dose is a weekly dose. And we talk about different types of side effects to watch out. And we talk about methotrexate inducer side effects and what are the medications they have to take to counteract those side effects. So that's what I do when I dispense a prescription, when I come see a prescription. Okay. So next, let's go to a little case study. I'll tell you why it is really important. Okay. Can I have a sip of water, please? Just a sip. Okay. It's a case study. It has happened. It looks very silly, but it happened in the practice. Okay. Okay, Mr. PT, because of the patient confidentiality, I can't remember the full name. So Mr. PT had got 3 years old daughter. Okay. And her daughter got some chest infection. Okay. And he took her to GP, and the GP looked at the medical condition, diagnosed, and he found out it's a chest infection. And he decided to give some amoxicillin antibiotic for 7 days course. It's a 7 days, he said 7 days course. And GP gave a prescription. And the patient, along with her daughter, came to the pharmacy, presented that prescription to the pharmacist. And the pharmacist dispensed, okay, liquid, and he gave it. We told everything, finished the course, keep in the fridge. Okay, so patient was happy, and the pharmacist was proud. Yeah, I did my job. I did my job. Pharmacist was proud. And then after a few days, the patient condition got deteriorated, and then they visited the GP again, and they came back with some different medication, and the pharmacist inquired, what happened? This is a simple infection. It should be treated. You got good medication. Why? Why did you make second visit to the GP? What's the problem? Tell me. And then Mr. PT said, pharmacist, he gave the medication, but you didn't tell me that I have to give orally into her mouth. You said, give 5 ml 3 times a day and put in the fridge. You didn't tell that I have to give medication orally. I started giving because she got, sorry, I forgot to mention, the patient got not the chest infection, the patient got the ear infection. Sorry, it's my mistake. The patient got the ear infection. So the father said, pharmacist, my daughter got ear infection. The infection is here. So I gave the medication directly to the infection. I'm pouring 5 ml 3 times a day like this into the ear. What wrong I did? Oh, Mr. PT, why did you do like that? It's a common sense that you have to give the medication to the orally, in the mouth, to her mouth. And they replied logically, pharmacist, you are confusing me. Last time I came to your pharmacy for my daughter eczema. She got eczema. You gave a cream and you said apply on the affected area. I followed the same principle. I applied the medication on the affected area. Mr. PT, what you said makes sense. Logically, you are right, but technically, you are wrong. This is a water. It's a water. You have to give it to the mouth. So that is the way it ended. So it's a tiny information. When you work in a community pharmacy, you presume some knowledge that patient has some knowledge, but actually, you come across lay patients, lay people. They don't know anything. They're simply like a robots. They're like a computers. You program them, what you want to program, they function in terms of the medication. So each and tiny bit, you have to be very careful. Okay? That's a case study. This is a good example why pharmacist plays an important role. Why the pharmacist, each and every information, what comes out from the pharmacist is really important. It's a good example. Okay, so what I'm telling is, once you dispense, the counseling is really important because patient doesn't have any knowledge about the medication, okay? And their GPs are not available to provide that information. And the pharmacist is the connecting link between your GP and the patient. You are the connecting link. So pharmacist is the connecting link between the GP and the patient, and you have to provide the required information, okay? That's it. Okay, let's go to the next slide. Okay, I told you, pharmacist is the only healthcare profession in the UK who can be approached without any prior appointment. Without prior appointment. Without prior appointment. Okay, so a lot of people, when they suffer with health conditions, okay, a lot of people, when they suffer with health conditions, they straight away approach pharmacists. They're like minor ailments, like they suffer with cough and colds, nausea, vomiting, diarrhea, migraine, if you got dry skin or eczema, if they got any insect bites, if they need any first aid, if they suffer with hay fever. And these are called minor ailments. They really don't need to see the doctor. These can be easily handled by the pharmacist, and they can save some time to the GPs. Okay, so it's one of the responsibilities. It's a very important role because point one, you treat the patient directly and you save the NHS time, you save the GP's time, and you save NHS money as well. So that is one of the services we do. So I'm not talking much about it. I think you got the information about it. And the next one is medicine usage review. A lot of people who suffer with long-term health conditions like diabetes, the asthma, okay, and they take a regular medication, and it's like a routine. They take it for a long time. Sometimes they don't realize how to take the medication, and they take medication the wrong way. So what we do when we dispense these long-term medication prescriptions, we tell the patient, hi patient, you got some time. Oh, what do you want to do, pharmacist? What do you want to do? Well, I would like to have a little chat with you. I would like to have a little chat with you, and I would like to have a little chat with you regarding your medical condition, and I would like to have a little chat with you your medication. Well, what do you want to chat with me, pharmacist? What do you want me to do? Well, let's sit down in the consultation room, okay, privately. We sit down privately and we talk for 5 minutes. And the patient said, yes, pharmacist, let's sit down. Okay, I'm glad that you are looking after me. I'm glad that you are looking after my medication. And then once you sit down with the patient, I look at their medication history and I look at their medication. I ask a simple questions. Okay, I take the medication box and I ask them, hey patient, okay, do you know? Okay, hey patient, do you know this medication, why it is prescribed to you? Do you know what does it do to your body? You know, what are the common side effects? And do you know what to do if you develop any side effects? These are the simple questions I ask the patients. And based on their answer, I provide necessary information. Okay, that's it. And sometimes when I'm doing MUO, I come across different things as well. The reason is, So patients, it's very difficult to get a GP's appointment, doctor's appointment. When see a doctor, a GP, when they see a GP, usually they have a 10-minute slot. In those 10 minutes, patients sometimes they don't have time to express their medical concerns to the GP. So they don't have time to express everything to the GP. Sometimes some patients are very shy. They're very shy to reveal their medical condition to their GP because they don't see the GP on a regular basis. They see GP once in 6 months, once in a year, and they feel shy to reveal everything to the GP. But they see pharmacist every month to get their medication. They develop some rapport with the pharmacist. They develop some rapport. They feel comfortable with the pharmacist. So when we sit down with them privately, they open their heart. They tell their all problems. Sometimes they tell some other medical condition which is not revealed to their GP because they didn't have time to see the GP. So here the pharmacist plays an important role. Pharmacist sometimes identifies new problems, new medical conditions, new health problems. And the pharmacist reports to GP. And the pharmacist arranges an appointment. Pharmacist arranges an appointment to the GP and the patient, and the pharmacist resolves that issue. Okay, so that is one important thing we do, that's all about medicine research. There's a lot to talk about, but because of the time limit, we try to keep our conversation minimum and a brief, just required portion. Okay, so let's go to the next slide. So let me give a simple example happened in my practice. So it's a case study. Okay, I got a patient called Mr. AM. Okay, he been prescribed aspirin 75 milligram, which is antiplatelet to thin the blood to stop previous heart diseases as a secondary heart attacks, whatever. So he been prescribed aspirin 75 milligram tablets. Well, we usually suggest people to take medication in the morning, first thing in the morning. After breakfast, aspirin is better to take after food because to prevent the side effects. Okay, so this patient being prescribed aspirin 75 milligram, when he was prescribed, and the GP told that take this medication on daily basis regularly. Take after food in the morning. The reason we suggest in the morning is if patient takes first thing in the morning, and once they got their medication into their system in the body, they don't need to think about the rest of the day. Once they start their routine, it's very difficult to remember your medication and take it. That's the reason we usually suggest people to take medication in the morning. So in the way, so GP said that take in the morning after food. But here the problem is, Mr. AM works in a warehouse. He does a night shift. He works from night. I couldn't remember. He does a night shift. So our breakfast time is sleeping time for him. So our breakfast time is bedtime. So obviously, so he thought, oh, I have to take in the breakfast time. What is breakfast time? The patient is just remember like this. Okay, my doctor asked me to take medication in the morning after my breakfast. Okay, what is the morning time? What is the breakfast time? Usually most of the people take breakfast in the morning 8 a.m. Okay, let's take this medication 8 a.m. Let's take breakfast because GP asked me to do. Let's take breakfast in the morning 8 a.m. and take medication. But the problem is that is his bedtime. He's reaching home after his work 4 a.m. in the morning. He's sleeping at 4 a.m. Okay, and he has to wake up. He has to put an alarm. He has to wake up and to take breakfast forcefully and take medication forcefully. It's not natural for him. Obviously, this kind of exercise disturbed his sleep. So it is breaking his sleep cycle. He couldn't sleep well. So in longer run, it led to insomnia. He got sleeping problems, which led to headaches. Okay. So one day when I was doing MUR, I asked him, Mr. Ahmed, what's the problem? We usually have different medication. Now I see that insomnia medication. What's the problem? You got sleeping problem. Why are you taking sleep inducers? Why are you taking sleeping pills? What's the problem? I asked it. And he said, Chiran, my pharmacist, okay. The problem is my GP asked me to take this medication in the morning after food, after breakfast. So I'm taking in the morning. I have to wake up. I have to wake up middle of my sleep to take this medication. That's the problem. And it is breaking my sleep cycle. And I develop headaches. I feel sleepless. That's the reason I got sleeping pills. And then I said, oh, Mr. A. Oh, Mr. A. You don't need to worry about it. You don't need to worry about it. Aspirin can be taken any time of the day. It can be taken any time of the day. It doesn't matter. You take morning, afternoon, or evening. It doesn't matter. We simply suggest people to take in the morning. In that way, you remember better. There is no specific reason. Okay. So from now onwards, take this pill before you go to your work. You go to work in the night time. Just take, before you go to work, take this tablet. That's it. Problem solved. That's it. The problem is such a simple information changed the patient life and daily life. So you see your importance as a pharmacist. Do you realize the importance? You see that importance? How important is such information? You and me as a professional think that this is a simple information. Oh, I haven't done this. Is simple information, but it is invaluable information to the patient. It makes their lifestyle changes. It makes their changes to their life. It makes us changes to their life. It makes changes to their family life as well. Okay, so you see the importance. Okay, let's move on to the next rule. New medicine service. What is new medicine service? Okay, sounds exciting. New medicine service. It's simple. The name itself says new medicine. When patients get a new medication, obviously they don't have much information about that new medication. As a pharmacist, I provide the necessary basic information to the patient. That's what I do. But you have to remember, I have to put them on clause. I don't provide new information to every patient, every medication. There are certain medication associated with, I only deal with any medication. If any patient suffer with heart diseases, diabetes, respiratory diseases like asthma or COPD or heart diseases. Okay, so if you patient gets medication related to these 4 diseases, then only I do new medication service. Okay, so excuse me, just a second. I got a question here. Okay, so well, I got a feedback that I have to finish in next 20-25 minutes. There are a lot of the information I have to cover. I'm going to be very quick. Okay, some people call me chatterbox. I chat a lot with my patients. This is my daily routine: chat. But I have to remember that I'm not doing my job here. I'm doing a presentation, so I have to be very quick. So very quickly we do it. Okay. So new medicine service. Okay, if any patient receives this any medication related to heart disease, diabetes, respiratory, and this condition, and if they prescribe a new medication, we do counsel them. I will explain this within a case study. Okay, the case study is so I got a patient called Mr. DT, who is 38 years old. Okay, he recently diagnosed with high hypertension, in simple term, blood pressure, high blood pressure, and he been prescribed ramipril 5 milligram capsules. Okay, and he started taking ramipril 5 milligram capsules. And as a pharmacist, what I did, once you get the new medication, I have to follow up the patients on a weekly basis. So 1 week later on, when I was giving out the medication, I did the counseling, and one of the counseling point I did was, Mr. DT, one of the common side effects is ramipril can induce dry cough, not chesty cough. Can induce dry cough, not chesty cough. If you develop dry cough, it means that nothing to worry. That is that the culprit is this medication. Okay. If you develop that cough, report it to me. So the patient was happy, took the medication home, started taking the medication. After 1 week, I rang him and said, Mr. DT, how are you getting on with the medication, Mr. DT? And he replied, Mr. Pharmacist, can you see I'm coughing? I'm suffering with dry cough. I said, Mr. DT, don't worry. We talked about it. This is your ramipril is causing that problem. Do not worry. I'll look after that. And immediately I typed a letter to the GP. Dear GP, Mr. DP is suffering with a dry cough. Can we change his medication? I would recommend as part of our protocol or guidelines that he could consider losartan tablets if it is clinically appropriate. And the GP was very happy with my letter, and he changed his medication to losartan. Later on, the patient's blood pressure is under control, and he didn't have dry cough. It's perfectly fine. Okay, let's move on to the next role. So these are, I'm just giving a brief introduction. I'm not talking about much about, I'm not going to in-depth details. I'm not going to in-depth details because they are not really that important. So substance misuse patients and methadone and buprenorphine, what does it mean? Like, there are some drug addicts, stupid idiots in our society who was addicted to the drug. So these people, they take drugs and they bother different people, they mug people, they loot people because of the drugs influence. There are some wing in NHS who pays attention to these kind of the patients. They catch these patients. Hey, you are drug addicted. Don't worry. I have some tablets called methadone and buprenorphine. Because drug addicted people, they need money to buy the drugs. So they started looting the people. So what we do, we catch those people. Don't worry. I have some medication. They exactly works like a drugs. Okay. And in fact, they don't damage your system. Drugs damages the system, but these medications don't damage your system. It keeps your mental health under control. And slowly when you feel better, you can feel that drug free. So those people, we identify these people and they come to the pharmacy on daily basis. I give their medication. These are called commonly prescribed medication or methadone and buprenorphine. These are the replacement to cocaine and heroin. And I give this medication to the patients and they take on daily basis. And these patients, they take on daily basis. What is the benefit? The benefit is you are looking after one drug addict, okay? And he doesn't cause any harm to the society. If you don't look after that drug addict, it can create havoc in the society. So you are keeping him under control. So that is the service. And initiating and monitor dosage patients. So what is monitored dosage system? And there are some patients, when you get older, when you are busy with your life, obviously you forget to take your medication. It happens to everyone, especially when you get elder people. When you become elder, you got lots of tons of medication. You got like 10 medication, 12 medication, 15 medication. It's very difficult to take. It is very difficult to keep track of those medications because you have to take one in the morning, one in the afternoon, one at night. It's very difficult to keep a track of those medications. Those patients I identify when I do MER, when I do medicine usage review. I speak to the patient, are you okay with the medication? And that patient says, oh, I forgot to take the medication. I have to admit, I have to confess, I forget to take this medication. Then I try to say, don't worry, I have a system called MDS system. What I do, I take your medication, I take a tray. Okay, in the tray, I got Saturday, Sunday, Monday, Tuesday. I get a tray. I put the medication in the different slot and just patients takes it. Okay. And I told you that administration of different vaccines are really important in this country because it's a cold country. Flu is a biggest problem. Flu and pneumonia is the biggest problem because here the people immunity is very low. And in older people and in people who are suffering with some long-term medical conditions, and the flu can kill the people, okay? And the NHS came with a brilliant idea. Okay, why can't we administer flu vaccination to the people and give immunity to the people? So what the NHS, what the research does, every year they do the research. They predict what kind of the virus strain they are going to get. And based on the virus strain, they develop a flu vaccination and they distribute to the GPs and they distribute to the pharmacists. And they say that, hey, identify the people who are suffering with the long-term medical conditions and administer flu vaccine, make them immune to the flu vaccine, make them immune to the flu. And so that's what I do, okay? I identify elder people who are suffering with the long-term medical conditions, okay? And I give flu vaccination and I make them resist. That's what I do. So that is important service, okay? And the people have different phobia with the needles. When they see needle, oh, I'm not giving my job. It pains me. And then I say, hang on, it's a tiny needle. It's a tiny needle. It doesn't cause you any harm. You just little pick and you get the medication. And some people, we help, we act like a psychology doctors and we treat their psychology, we reduce their phobia, we get rid of their phobia about the needles and we do the vaccines, okay? And community pharmacy consultation service, very briefly, I'm not going to talk about the case study here. What it is, I told you that in the past that the people can't do, public don't get the time. It's very difficult for them to make the appointment with the GP. So those people give call to NHS. Then NHS telephone line is called 111. They ring the NHS and they explain the problem. And NHS people, what they do, they refer the patient to the pharmacist, and the pharmacist sit down in the consultation room. They have a consultation and they treat with their medical condition. If the pharmacist can't treat their medical condition, immediately he make a referral note to the doctors here and is an appointment with the doctor. So we help the patient. So we help if the patient doesn't know where to go, he goes to the NHS 111. He rings NHS 111 and the NHS 111 sends the patient to me. I assess the patient clinical condition. If it is very serious, I will forward him to the GP. I make an urgent appointment with the GP. If his condition is not urgent, I treat them. I advise them lifestyle changes or simple medication. Okay. So what's the other pharmacists do? Liaising with the GPs for the better treatment. Okay, so for example, this, I must say this, I got a older patient who is 82 years old patient. She was suffering with mouth ulcers. She tried different types of medication, which available from the pharmacy, which none of them helped with her mouth ulcers. She couldn't sleep at night time. She literally couldn't sleep because of the pain and the soreness in the mouth. And the patient came to me and I said, go to the GP. And the GP rang me, what can we try? Chiran, what can we try? Chiran, what can we try? I can't think of it. She tried all the medication to relate to the mouth ulcer. What can we try? I said, doctor, we can do one thing. I know it is not licensed to use for mouth ulcers, but we have some ampules called lidocaine, which is a local anesthetic ampules. You can prescribe that. Patient can break the ampule. They can apply to their mouth. It reduces the relief. And the GP agreed, and they gave the prescription to lidocaine ampules. And the patient followed our instructions. And the mouth ulcers problem is sorted. And the patient is happy. See, can you see how we can help the people? Can you see how we can advise GPs? You can see how we can liaise with the other healthcare professionals for the better patient outcome, to the better managing patient's disease. Okay, and the next one is 10th. I also talked about private services. Okay, we do travel clinic if anyone is going to different countries and they need some vaccines like yellow fever vaccines. I do sore throat testing. And I treat urinary tract infections. I prescribe some antibiotics. I treat erectile dysfunctions. I treat male, if anyone is losing hair, and I treat male pattern baldness. Okay, these are the different services which patients can't get from NHS. So we run these services and we charge the patient and we run the services. You see, we are helping the patients in different ways. Okay, so let's go. So apart from the clinical role as a pharmacist, you have, in some cases, you have to engage in administration activities as well. In simple terms, they are called managerial activities. You have to manage your pharmacy. You have to manage your pharmacy. What you have to do? First, you have to recruit the staff. You need staff to manage your pharmacy. You have to recruit the staff. And then once you recruit the staff, you don't want your staff to be the rubbish. You need to make sure they are doing well. So you sit down with them on a regular basis. Okay, you have to do staff appraisal and you have to tell them where they're doing well, where they're not doing well, how to improve. We have to improve their performance. And then one of the biggest aspect is, so we run the pharmacy, of course, to run the healthcare system, but however, we need money as well. It's a business, we need to get the money. Where do we get the money? You need to work in a cost-effective way. What you do, you need to order stock from the cheapest wholesalers. You've got dozens of wholesalers in the market, but some people charge higher charges, some people give discounts and offers. You need to get in touch with the wholesalers on daily basis, on a regular basis, and you need to identify cheapest wholesalers, and you need to order stock from the cheapest wholesalers. Okay, and then you in a pharmacy, you got the dispensing pharmacy. This is the pre-lit pharmacy, and you got a front part of the pharmacy. It is called shop, where you display a lot of different types of product, non-clinical products. Okay, so we need to look after our shop. We need to look at the products. What products are selling better? What products are not selling better? Shall we take off the new not selling products, dead stock, or can we introduce new products? And we have to look at the sales and we have to generate the review. And at the same time, you have to maintain a good relation with other healthcare professionals. You have to, what you see other healthcare professionals. You have to liaise with your GPs. You have to liaise with nurses. You have to liaise with different types of specialists in the hospital. You have to liaise with them. You have to communicate with them to keep your health, your daily activities flowing well. And then, obviously, that what best you do. There are some nuts in the society, okay, who are not happy with your service. Okay, there are some people who are not happy. Some people who have got genuinely complaints. When the patient complains, you have to deal with the complaint. You have to deal with it as per the protocol to protect your goodwill of the pharmacy. Okay, and you do everything, but don't forget you have a boss on top of your head. You have to report to them on a regular basis. Okay, I think you are clear about it. Let's move on to the next slide. So, hey, Chiranji, you talked about many things. Okay, I'm very happy. I feel proud to become a pharmacist. But once I become a pharmacist, what can I do in a community pharmacy? Well, friend, you can work as a pharmacist. Okay, if you're not happy, later you can work as a pharmacy manager, just slightly above the pharmacist position, because when you are working as a pharmacy, you're just dealing with your clinical roles and responsibilities. When you become a pharmacy manager, you are dealing with your clinical role as well as administration activities. You can become a pharmacy manager. And you can become a store manager. Here you got a big company like Boots. People who knows the UK, people, whenever they think about the pharmacy of the UK, they think about a company called Boots. They got about 4,000 pharmacies, 3,000 stores. Okay, they're like a bigger stores with a supermarket. Like they look like a supermarket. They're very, very big stores. So in the store, you have pharmacy department and your store. Okay. So when you are a pharmacist and you can work as a pharmacist in the store, you can work as a pharmacy manager just to manage your pharmacy area only. But with the further training, the companies make your pharmacy manager to become a store manager. You can be store manager. Okay. And pharmacy and operational manager. What is operational manager? Well, in a pharmacy, you got standard protocols. You got SOPs, you got patient complaints. You need to deal with this paperwork. So you have to deal with the daily operational activities. You need a person. They are called operational manager. And what is area manager? When you got a company, big company like Boots, when you got 3,000, 4,000 pharmacies, they appoint a manager, area manager for 10, 15 pharmacies. Okay, they appoint an area manager. Under area manager, we have individual pharmacists. These individual pharmacists get in touch with the area manager. They discuss our daily concerns and they run the business. They run the pharmacy. So that is the area manager. And business development manager. You understand what I mean by business development manager from the title, that their role is to develop the business. And the independent prescribing pharmacist. This is a new role. It's very quite exciting role. And once you qualify as a pharmacist, you do a short course, which is a 6-month course, which is called independent prescribing pharmacist role, which means you can prescribe prescriptions. You can prescribe like a doctor. You can prescribe medication to the patient, because a lot of the patients got the regular medical condition. They don't really need to see the doctor every time. They can approach a pharmacy and get a new prescription. This is a new role. And we, at the moment, pharmacists who got this IP qualification, they are working in GP practices. But at the moment, we are not sure how NHS is going to implement this in our community pharmacy. Okay, so it's a new role. Forget about it. So what are the other healthcare professionals when you work in a community pharmacy? You need to look after your colleagues as well. Who are the other colleagues? So the colleagues are, you got medicine counter assistants, you got dispensing assistants, you have a dispenser, you got a pharmacy technician, you have an accuracy pharmacy technician. Sometimes you got non-pharmacist manager. In a pharmacy, you got a pharmacist and a pharmacy manager. They're not a pharmacy, but they manage the pharmacy. And you see medication delivery drivers, means when you dispense medication, some older people, they can't come into your pharmacy to get you their medication. They're handicapped, they can't work. For those patients, we do home delivery. So our delivery driver takes the medication and delivers to the patients. So you got medication delivery drivers. Okay, so we talked a lot about the hospital pharmacist. In fact, I can talk about throughout the day because that is my role. But however, for the benefit of you, you need to understand. I told you that the pharmacist is going to work in a hospital. Okay, and just excuse me 1 minute. I got a little message. Let me read that message. Okay, so. Well, I just got some comments. I'm just looking at the comments. I'm trying to incorporate those comments while I deliver my presentation. Okay, so when you work in a hospital pharmacy, okay, you got a pharmacist qualification and you go to the hospital. Once you go to the hospital, you do a short course, which is called clinical diploma. Okay, you do the clinical diploma, which is 2 to 3 years. It's a part-time. While you're working as a pharmacist, junior pharmacist, while you are working as a junior pharmacist, you do this clinical diploma and you get a specialty. So what are those specialties? Once you finish that diploma, you are a specialist pharmacist. You are a pharmacist with a special qualification like a doctor. So you can be a geriatric pharmacist to look after the older people. You can be a pediatric pharmacist to look after babies. You can be a mental health pharmacist. I told you that in the UK, a lot of people got mental health and you can look after them. And you can be an antimicrobial pharmacist, means to deal with the antibiotics and to deal with it. In a hospital, you got a production department to manufacture some medication. So you can, this pharmacist lays in that production department. And you can be a renal pharmacist, kidney pharmacist, you can be an oncology pharmacist, means a cancer pharmacist, you can be a surgical pharmacist. Once the patient got operation, they need to be looked after their pharmacist. You can monitor their medication. You can be a surgical pharmacist, you can be a hematology pharmacist, you can be a medicines information pharmacist, means that in a hospital, they have a medicines information department. And if any got questions about their medication, anything about the medication, they can ring the hospital helpline, and the medical information pharmacist provides the information about that medication. Okay, again, Royal Pharmaceutical Society of Great Britain did a nice video about the hospital pharmacist role. It's about 2 minutes role. Make a quick note of it and watch in your leisure time. Okay, let's go to them. Hey, interesting topic. This is where you don't get this information from anywhere apart from me, or if you do your own research. After your B pharmacy, after your graduation, once you decided to study in UK, most of the people, what they do, they go to the consultants, they approach consultancies in UK. So this is the information consultancies, they never disclose to you. They never disclose, they never tell you how to become a pharmacist in UK. They never disclose that information because they don't get any commission. They only disclose the universities and the courses which they get the commission. So without their help, if you want to consider a career in UK, if you want to become a pharmacist in UK, you can do your own process and you can become a pharmacist. This is the process. First, you need to make an application to GPHC, General Pharmaceutical Council. So General Pharmaceutical Council is the body like a Pharmacy Council of Andhra Pradesh. So General Pharmaceutical Council is a body which maintains, manages registrations of pharmacies. And you need to make an application to them. You need to make an application saying that, oh, dear GPHC, I studied in India. But I want to practice as pharmacist in UK. So that's the reason I want to do overseas pharmacist assessment course, which enables me to practicing as a pharmacist here. So you need to make an application to become to GPHC. You need to make an application to GPHC expressing an interest to do an overseas pharmacist assessment course. And then the GPHC evaluates your applications. It's also some documents. You need to provide your qualification and some references, okay, etc., etc. Once you got the complete set of application, and the GPHC goes through your application, and then he thinks, yes, this is the right candidate. Yeah, he can study this WOSPAP, and then they give an approval letter to study WOSPAP, to study the course. And the WOSPAP is a 1-year full-time course. There are only five universities offering those courses. I will tell those 5 universities in next slide. So I lost track. Sorry, give me one. Yeah. So you make an application to GPHC. GPHC provides an approval letter. And then now, next step is you need to apply to the university. You need to apply to the university to study the WOSPAP course. So you got the approval letter from the GP in one hand. In the other hand, you got the qualifications. Together, you make an application to university. And you get an admission. The next is you get an admission into the university. Go to the university. Okay, go to the university, study well, and finish the course, finish the WOSPAP course. And then you have to work under a senior pharmacist for 1 year. You have to work 1 year. And when you are a trainee pharmacist, technically you are called pre-registration training pharmacist. You have to finish 1 year pre-registration training under super pharmacist. And then you have to sign off by your tutor saying that you are good, practically you are good. Your supervising pharmacist said practically you are good, enough, you got enough skills to practice as a pharmacist, and they sign off your coursework. And then you have to sit for an exam, which is conducted by GPHC, and you have to sit for the exam. There are 2 papers, morning paper and evening paper. You have to secure at least, the pass mark changes every year, but as far as I know, at least minimum 70% have to score. You have only three attempts. If you can't pass this exam in 3 attempts, that's it, you can't be a pharmacist. You have to score 70%, okay? It's very important. I hope you are very clear, but however, don't worry. I will provide a link where you can get all this information. So one important point I forgot to mention, when you make an application to GPHC, you have to prove that you are well in English, okay? You have to appear for IELTS, academic IELTS, and you have to score 7 in each section. That is very important there, because you are telling GPHs that you are competent in English, okay? And then there is a link, okay? If you go to that link, it takes you to the GPHC website. It talks about WOSPAP. It talks about WOSPAP. It talks about the whole process, how to become a register, how to register as a pharmacist in UK. When you got time, if anyone was interested to become a pharmacist in UK, I would strongly recommend you to go through that document. This is like 50 pages document, but read it once, twice, and thrice, and gain the information. Don't be cheated by local consultants. Don't be cheated by local consultants, and don't be don't be misguided by local consultants. Use your own brain. The document is very simple and straightforward. Read it. If you can't read it, take the document to, if you can't understand, take the document to your professors, take the help from the professors. In SVCP, this is a message for Sri College of Pharmacy students. In your SVCP, you got your program coordinator, Sri sir. He's written from UK. He knows this process very well. You can approach him, okay? So these are the list of the 5 universities when you got time. So go to these universities and go to their university website and look at their, explore and look at the fee. The fee is usually between £10,000 to £15,000, depends upon the university, okay? And they are located at different parts of the UK. So please go through and do your own investigation, okay? So, hey, Chiranjeevi, we sat down 1 hour. We heard everything what you were saying, because and then you are coming to, we know that you are coming to you. We know that you are going to talk about it. This is our interesting bit. Now, be practical. Yes, you need to choose a profession where you can get enough money to live, you pay your bills and live your life. So there's nothing wrong talking about salary in this presentation. That's what I feel. So your salary expectation, once you are a newly qualified pharmacist, you get £35,000 per annum, okay? And oh, I can see someone taking the calculator, £35,000 divided by 12. And how much is the monthly income? My friend, it doesn't work like that. That £35,000 is the before tax you get paid. After tax, you get paid something less than that. Don't worry. There is a government on top of your head. It will be UKB takes your money to provide, to look after you. So you get £35,000. You go to the website and simply type, £35,000 after tax in UK. You get, how much you want to get after tax. Okay. So with your experience, I told you that in a community pharmacy, there is a career ladder, different career ladder. In a hospital pharmacy, you start as a junior pharmacist with your clinical diploma. Once you become a specialist pharmacist, you go to the upper career, and in 4 to 5 years, depends how you perform and what are the opportunities in our hospital, in the community pharmacy, for which company we work, in which hospital you work. You can expect a salary after 5 years, 60,000 to 70,000 pounds per annum. Okay, again, that is the salary before tax. So you always use the calculator to get how much you get after the tax. So that is the one. And after 70,000, be honest with you, it's very difficult to get the pay hike. So that is like a kind of ceiling. After it's very difficult to get highest salary. Maybe if you become a pharmacy owner, if you buy your own pharmacy, maybe you can earn more than that. But which is not that straightforward. It involves a lot of money. But when you come to UK, don't think much about it. When you come to UK, you think about it. Okay, there are some websites. These two are the first three websites, especially for pharmacy people. Especially for the first two websites, especially for pharmacy, 1 and 2, PJ jobs, and see just only for the pharmacy people. And NHS jobs, it lists all the hospital vacancies, and it also lists pharmacist vacancies. And Indeed jobs, it advertises everything, including chaff cleaners. So you just need to screen what job you are looking for. Okay. And then I think, oh, thank you very much for bearing me. The last slide is, if you're seriously considering career in the UK, please make note of these two websites, Royal Pharmaceutical Society of Great Britain and General Pharmaceutical Society. As these two websites are really, really important. If you go to these two websites, you get a lot of information, but you have to explore, okay? And then thank you very much for bearing me. And I would like to thank SVCP, Sri Vishnu College of Pharmacy, director, principal, and the program coordinators. And thank you very much for giving an opportunity. And finally, hey, I'm not leaving you guys now. Still, you did listen to me, so I have to listen to you. So what is this? Question and answers. Okay, if you got any questions, I don't know. With new technology, how I'm going to get your questions. I'm sure that our program coordinators would help us to pass your questions to me. I'm happy to answer your questions as much time as you want. Okay, so I will hand over back to our program coordinator, Sri sir. Sir, could you please take over, and could you please tell me what is the process to take questions from our audience, please?
Sure. Thank you. Thank you, Mr. Chiranjeevi. Am I audible?
Yeah, I can hear you. I can hear you, sir. You can
so first of all, thank you very much for this wonderful session on
it's a pleasure.
Showing the role and most importantly, the clinical role, the differentiation between the clinical role and the administrative role a community pharmacist should have or will have once they become a community pharmacist. In addition to that, you have also addressed upon various aspects of what NHS is doing and the importance of NHS and how it could change the healthcare system, or where the patient is the center of the healthcare system. It is not any other healthcare professional. It is the patient-centered healthcare system. That is good from your side, and also touching upon various possibilities of becoming a hospital pharmacist and the ever-increasing importance of a pharmacist, even either in ambulance, in ambulances, and also as an independent prescribing pharmacist. Okay, so with all these side things apart, I would also like to thank you in particular. I think which is more useful for students is the career advice that you have given on how to become a registered pharmacist in UK. Giving your experience, it is very, we are really delighted to have such an information from you, Mr. Chiranjeevi. And
thank you.
It was breathtaking and it was awesome. Your presentation skill is awesome, I have to say. And the question and answer session would be like this. Now there are few participants in the Zoom session who
yes.
will be asking questions directly to you. And in case the other questions which are coming on YouTube links, we would be from the question and answer session, we would be asking, I would be asking after this Zoom participants. Okay, in case if we have a number of questions, we will forward to you to your personal email ID so that you might take some time to answer them later.
Okay, fine.
Shall we proceed with question and answer sessions?
Yes.
Yeah, please. So the participants from Zoom sessions, you might you can unmute your mic and ask the questions, please.
Hello, sir. Good afternoon, sir. This is applied from Pharm.D.
Oh, hello. Hi. Good afternoon. How are you?
Oh, fine, sir. Fine. How are you, sir?
Okay. I know I talk a lot, but I'll take the question straight away because I feel like talking a lot to you. But however, I'll keep my answer question, please.
Sir, what was the scope and opportunities, especially for the Pharm.D graduates in NHS?
So, well, this is a kind of disappointing news, to be honest with you. Whether you study 4 years pharmacy degree or whether you be pharmacy, whether you study Pharm.D, there is no special recognition if you want to work as a pharmacist. If you want to register as a pharmacist in UK, okay, this is the same process. You have to do the OSPAP course, and the GPHC treats your application same as a B.Pharmacy. So they treat the same you as a B.Pharmacy graduate. That's it. So there is no short procedure. There is no concession in your procedure to register as a pharmacy. You have to go through the same procedure as the B.Pharmacy graduate goes through. But however, the only thing, once you register as a pharmacist, I'm sure that in Pharm.D you study a lot, and in your training you learn a lot. Probably you could, with your knowledge and the experiences, you could prove you are a good pharmacist, you are a better pharmacist. You need to remember one thing: just qualifying as a pharmacist is not registering as pharmacist is not just a final step. That is a starting step. That is your first step in your career ladder. But with your experiences and your qualifications and your knowledge, you can progress a lot in the pharmacy. So I'm sure that your Pharm.D helps to achieve those goals. Did I answer your question? Okay,
yeah,
so it looks like he's okay with my answer. So I'm happy to take another question. Okay.
So just to add on, Mr. Chiranjeevi, if you permit me. So it is like this, as Mr. Chiranjeevi just now said, the process is same, and always you begin as a registered pharmacist.
Yes.
Yeah. However, you always have an advantage that you can become a good pharmacist because you study in depth of the therapeutics part. That's what the speaker is, Mr. Chiranjeevi, is having is the intention of Mr. Chiranjeevi, isn't it, Mr. Chiranjeevi?
Yes, that's right. I would like to add a little point. Okay, at the moment, these are the guidelines. Maybe in the future, GPHC might review the guidelines constantly changes based on the circumstances and time. So maybe in the future, they might change some procedures for the Pharm.D graduates. We never know. So what I would suggest, any Pharm.D graduate, if they come to UK, just send an email to them saying that I'm a Pharm.D graduate, studied 6 years, and my application is treated same as manner as the B.Pharmacy graduate. So I think this is unfair. Would you please consider our application, especially if they ask these questions to the GPHC, when they get these kind of requests, considerable amount of the request, they might start thinking about Pharm.D and they might change their procedures in the future. We never know. It happened in the UK a lot of times. So I would strongly recommend all the Pharm.D candidates who are considering career in the UK, just send a little email to GPHC saying about your status.
Next question, please.
I think that is the only question they got in the 200 audience. Probably they got the only question. They might have nominated Appal Naidu to ask that question as a leader.
That might be correct. We don't know. Any other questions from anybody else from Zoom sessions? If not, I would move to the YouTube questions.
Well, I'm sure that you get a lot of questions on YouTube because it's easier to type rather than asking at this stage.
You are right. So it's okay. I'll move into the questions which are on question and answer session. So first one is from Prerana Singh from Sri Guru Ram Rai University. Her question is pharmacist eligible for minor treatments in absence of a doctor?
Yes. The answer is yes, and the answer is no. Okay. When you are working in a community pharmacy, you treat your minor ailments with certain qualifications, and we do a short-term courses, and we gain special qualifications, and we deal with the directly. We deal with them. We treat the patients directly without a GP intervention. So the patient can walk into the pharmacy directly, and we treat them. It's not only minor ailments. There are some conditions where the pharmacists get special qualification and treat them. For example, prescribing antibiotics, dealing with sore throat, infection of sore throat. So these are conditions a pharmacist can treat. patient directly comes to the pharmacy, pharmaceutical, but this is a private sector. It comes under private sector. And a pharmacist can also, the answer is yes here. If you are a community pharmacist, the answer is yes, you can treat the minor ailments. Yes, the answer is yes, you can treat the minor ailments without GP intervention. You got the full authority, you take the full clinical responsibility for that condition. But if you work in a GP practice, if you work in a hospital, you don't have the authority. You have to work under GPs, okay? You need to be, you are supervised by the GPs to treat these conditions, okay? Because it's a new condition, any new condition, you can't treat the patient. So GP has to deal with the condition and you can support the GP. But if there's an existing long-term condition and you can prescribe and you can treat, you can change their medication, you can prescribe, that is possible. So this is the, again, you need to make a note. These are the answers. What I'm giving is based on the current practice. The practice is constantly, NHS is constantly changing and our role is constantly evolving. I've been working in pharmacy since last 12 years. My role evolved massively. So this is answer now. Once you come to the UK, the answer would be different. Okay, at the moment, this is the answer. Next question.
Yeah. Thank you, Mr. Chiranjeevi and Ms. Prerana. I hope you got your answer. And next question is from Naveen of Shri Vijay Vidyalaya College of Pharmacy, where his question is, can anyone help with diabetes prevention programs as a community pharmacist? I didn't get his complete idea, but I do understand that as a community pharmacist, can you involve in diabetes prevention programs?
Okay, good question, Naveen. I hope you are well. You're doing very well. Okay, so there are two aspects I need to highlight. In a community pharmacy, we are called healthy pharmacy, healthy living pharmacy. Community. This is a special qualification. We need to. It's a special certificate we need to get from our organizing bodies like Royal Pharmaceutical Society or General Pharmaceutical Society. We need to get a certificate called Healthy Living Pharmacy, and we have to follow certain procedures, and we need to make an application. And once the application is approved, we are called Healthy Living Pharmacy. We get a certificate called Healthy Living Pharmacy. As a part of the Healthy Living Pharmacy, our main role is educating the public about healthy living. Healthy living, which includes prevention of the diseases. What we do in our pharmacy, we have a section called Healthy Living Pharmacy section. Once in 2 months or once in a month, we display a lot of different types of posters and pictures. We provide information on a chart, how to prevent the conditions, how to prevent the diseases, how to live the healthy lifestyle. So it is based on the condition. So 1 month I might have healthy zone. It's called health zone. In one month I got health zone for diabetes. In other month I got health zone for blood pressure. In one different condition. In 1 month I have health zone for how to stop smoking. So like this, you got different health zones we display, and in the people, they read the information. If still they have questions, they can always have chat with me at the pharmacist, or they can chat with trained people in our pharmacy, and they can get all the questions answered. So so this is one thing we do. And the other thing is when we do MURs, we talk about healthy living, okay? And the GPs, when the patients see a GP, they talk about healthy living. And I also told you about independent prescribing pharmacist is called IP pharmacist. When you do IP pharmacist, there are different types of IP specialties. Diabetes is one of the specialties you can opt, and you can become diabetes specialist pharmacist, and you can treat people with that condition by prescribing. Okay. I hope, Naveen, I answered your question. If you got further questions, you can still leave a message with our organizers. I'll do my best to answer it later on.
Thank you, Mr. Chiranjeevi. There is another question. This is something related to career advice and a few aspects related to UK entry. Okay. So the question here, it is from Sujana Bhargavi of Vignan Institute of Pharmaceutical Technology. And she said that she is a Pharm.D student and who is aspiring to do this OSPAP and has a bit of confusion with GPHC, which I think she will get the answer, no problem. But she is doing her final month of internship, and can she apply for such a registered pharmacist program directly from India? First question is directly, can she apply directly from India? Second is, what kind of visa is she eligible? And is she going to get a 3 years post-study visa or not? There are three questions from her. One is, can I directly apply from India to become a registered pharmacist? Second one, what kind of visa is she eligible for? And will she be getting 3 years post-study work visa or not?
I expected this question actually. I've been waiting for this question because this is a question everyone got in their mind, and this is a question needed as well. The people need this answer. Srijana, thank you very much for asking a good question, another good question, which is very useful to all the aspiring pharmacists in UK from India. Okay, well, the answer is yes. You can apply to study a OSPAP course directly from India. As I told you, this is the information you don't get from the consultancies. They don't reveal this information. When I came to UK, I was not given this information by anyone. Okay, the answer is yes, but you need to remember, making an application to GPHC is like 2 to 3 months process. Okay, the documentation takes about 2 to 3 months. It's not a complicated documents. It's easy documents, but you need to get a reference letter from your pharmaceutical society, a good standing reference letter from your local pharmaceutical society, which is Andhra Pradesh Pharmaceutical Society. Okay, I guess you are from Andhra Pradesh. So you need to get a good standing letter from Andhra Pradesh Pharmaceutical Society. And you need to get a good standing letter from your university or college where you studied. You need to get a good standing letter from your professors. Okay. So it's not that you take the letters from them and you pass it to GPHC. No, it's not like that. A good standing letter need to be directly posted from your university or your college or your pharmaceutical council directly to the GPHC. There is no middleman involved. They post the letter and the GPHC receives it and they attach with the file. So when you make an application to GPHC, you just fill the application, you pay the fee, and you enclose your academic documents, okay, and you send the application. And the GPHC, they want some certain documents directly from the organization. One is your certificate, your pharmacy certificate. They want to receive directly from your organization. So it could be your university. So the university people have to directly post your academic transcript to the GPHC. That is, they want to receive directly. One thing in terms of your qualifications. And the second thing, what they expect is a good standing reference letter from your local pharmaceutical council. And the third one is a good standing reference letter from your college or university where you study. These three documents, they have to receive directly from the organizations, not from you. But however, you just need to make an application. So it is a time-consuming process because approaching your organizations, approaching your university, arranging the reference letter, posting them to the GPHC is a time-consuming process. Once they receive your application, they just don't evaluate your application on a daily basis. So once they get the application, once in a month, twice in a month, they sit down and they evaluate all the applications at once. It means that once the application is reached to the GPHC, there is a waiting time from the GPHC to evaluate your application. So in simple terms, the answer is yes, you can apply from India. Okay, go to the link I provided. You get lots of information about it. 1, 2, give yourself a time. At least the courses always start in September. Okay, so plan in advance. You can start from your 4th final year onwards. You don't need to wait until you complete your university. You can start from your final year. Plan in advance from 6 months to 12 months in advance. You plan it. Okay, that's the question answer. In terms of visas, be honest, these visas is a complicated system. They always change on a daily basis. So I can't answer that 100%, but with my knowledge, you will get a student visa, which is called Tier 4 visa. It's called a student visa. So once you get the admission from the university, you get a student visa called Tier 4 visa. And a post-study work visa, at the moment the government is thinking about post-study work visa, I think it is going to be implemented in the future. I'm sure that it is going to be implemented, but we haven't got the 100% confirmation from immigration or border and immigration services of UK. So you might get it, so think positive, you might get your PSW visa, but nothing is confirmed yet. Okay, thank you, Susan. I hope I answered your question. Sir, can I take the next question?
Yes, please. There is the next question here. It is from Christina Joshi from Acharya and B.M. Reddy College of Pharmacy.
What's the name, please?
Christina.
Christina, okay.
Yeah, and her question is something about yourself, where you have initially started your career as a pharmacy technician. Later, you did your OSPAP and registered with GPHC. And how did you initially reach as a pharmacy technician? How did you get a scope or doing job as a pharmacy technician is her question.
Okay, so I think you answered that question better than me. Those days you are next to me. You are in UK. I'm just joking. I'll answer it. Okay. Okay. Well, so when I came to this country, a pushkara ago, 13 years ago, there was a different role. If you are a qualified pharmacist from different country, you can register. You can register with the local pharmaceutical council (GPHC) as a pharmacy technician. And once if you are a registered pharmacist from a different country, you can register in the UK with the UK Pharmaceutical Council as pharmacy technician. So that's what I did. I did my master's here. Obviously, at that time, Britain was in 2008, it was in recession. There were not many opportunities in pharmaceutical industries. So compared with the healthcare sector opportunities, the opportunities in the UK, in the pharmaceutical industry and research industry, the opportunities are very less, very less. Because NHS is a big healthcare system, you got lots of opportunities as a pharmacist. So because after my master's in pharmacology, and I tried to get an admission career in university. I was not keen to go into the pharmacy profession because, you know, since we childhood, we grown up as a medical store. I don't want to be called by, I don't want to tell people in India that I work in a medical store. That's the reason I avoided pharmacy, just as an ego, but which is not true. Once I came into the career, I feel proud. So I couldn't get the opportunity. That's why I registered as a pharmacy technician. I started my career as a community pharmacist. Okay, and then once I started a career in community pharmacist, and I registered as a pharmacy technician. I started my career as a pharmacy technician in community pharmacy. Once I started as a community pharmacy, immediately I couldn't understand the importance of a pharmacist role, because I was just treating the job as a money generating profession, not for my heart was still in other sector, pharmaceutical industry sector. Because when you study in India, you always think about the pharmaceutical industry. So my heart was not in pharmaceutical industry sector. My heart was in pharmaceutical industry sector. My heart was not in community pharmacy. It took me some time, like 3 to 4 years, to understand the importance of the community pharmacy. Then I realized the importance of the pharmacist and their role in the healthcare system. And then I decided to become a pharmacist, register as a pharmacist. Then I started moving my file to become a registered pharmacist, and I did it. That's all. So did I answer the question? Anything else?
So yes, Mr. Chiranjeevi, and one last final question.
Yes.
It was also from one of the previous questions only. The question is from Sujana. The question is, because I think she represents a lot of Pharm.D students here. How about hospital pharmacy profession? Is there any different approach in order to become a hospital pharmacist, and how it is different from community pharmacist approach in order to establish themselves as hospital pharmacists in UK?
Okay, so let me understand the question. To become a hospital pharmacist, is there any different approach?
Yeah. You're
Number
right.
2, how does it varies from community pharmacist?
Yeah. Is there any difference in the process to follow in order to become a hospital pharmacist?
Well, the first step in this process is you need to register with the GPHC as a pharmacist. You need to register with the General Pharmaceutical Council as a pharmacist. That is the first step. Then you will be called as a pharmacist. You can't be called as a pharmacist because you went to the university. Until you registered with them, until you got the registration number, you can't be called as a pharmacist. You might have the qualifications, required qualifications, but still you can't be called as a pharmacist until you registered with them and you got the registration number. So for the registration, the process is common. Everyone is the same. So local students, Britain students, They have to register with the GPHC. They have to go for 1 year training. They have to sit for the exam. That is the common. That is not something uncommon for. The only thing we do different from local people is we do OSPAP course, 1 year OSPAP course. That is like a sandwich course. That is the only thing we do. Once you've done the OSPAP, it could be a local student, or it could be overseas student. They have to finish 1 year training, and they have to sit for the exam, and they have to secure 70% pass mark in the exam, and they only got 3 attempts to appear for the exam. The process is the same. Once you pass the exam, then with your pass result, you need to make an application to General Pharmaceutical Society, and then you'll get the registration number. There is no other process to become a pharmacist. It is a common for local students and overseas students. Once you become as a pharmacist, so now the ball is in your hand. Where do you want to throw your ball? You want to throw the ball into the community pharmacy, or you want to throw that in the hospital pharmacy, or do you want to throw that in the CCCs, or do you want to throw somewhere else? So the ball is in your court. Then you depends upon your interest and the area of your interest. You need to start applying for the jobs. You just apply for the jobs in the hospital. You attend to the interview, you impress the interviewer, and you get the job. That is the way to you become a hospital pharmacist. Once you become a hospital pharmacist, the role is there is a drastic difference in the community pharmacist role and the hospital pharmacist role. When you are a community pharmacist, you work for a longer hours because the pharmacy is working longer hours. You work for 8 hours, 9 hours, 10 hours, 11 hours. Sometimes I work 10 hours, sometimes I work 11 hours. Especially the pharmacists in London, they are open for a longer hours. And the pharmacists in outside London, they open for shorter hours, like 8 hours, 9 hours. But in London, the pharmacies are open like 11 hours, 12 hours, 14 hours. So a community pharmacist works for a longer hours. In a hospital pharmacy, it's a standard working hours, 9 to 5:30. So you work only 7.5 hours. So that is the first difference. And the second thing is, in terms of the role, it varies a lot. In the community pharmacy, you play different types of role. In the community pharmacy, you play clinician role. Okay, it's a minor clinician role, and you work as like a administrator, manager. You are like a salesman. You need to look after your pharmacy, and you need to improve the pharmacy product sales. You are like a salesman. You are like a role model, whatever. So you play different sort of roles, and you should be like a businessman. You should have business common sense and way to generate the profits, how to generate the profits. So these are the things you need in our community pharmacist. But if you go to the hospital pharmacy, you are purely a clinical role. You don't have these roles. You have some managerial role because when you progress, you become a lead pharmacist, and under your lead pharmacist, you got different junior pharmacists. You need to lead them. Again, you are leading them mainly as a clinician. So you are like a lead clinician. If you go to the hospital, so you are play a clinician role mainly. And your clinician role is, compared with the community pharmacy, is a superficial clinician role. You only deal with the minor things, minor elements. When you go to the hospital, you gain specialty and you learn in-depth clinical. You deal with in-depth roles. So if anyone wants to get that satisfaction, clinical satisfaction, then you should become a hospital pharmacist. So, and once you become a hospital pharmacist, and so I told you that there are different types of pharmacists: military pharmacist, prisoner pharmacist, CCC pharmacist, independent prescribing pharmacist. And when you become a hospital pharmacist, from community pharmacist, switching from community pharmacy role to other role it's not that easy. It's not impossible. It's not that easy. That's straightforward. But if you work in a hospital pharmacy, and if you are a hospital pharmacist with some experience, it is easier to switch on to different roles. It's easier to go to the CCC, easier. I don't say it's very easier. Compared with community pharmacy, it's easier. You can go to the CCC, you can go to the GP practices. In fact, you can go to the clinical researchers, you can go to the pharmaceutical industries. So the options are more easier compared with the community pharmacy. The options are more because you are mainly dealing with the clinical things. Okay, so that is about hospital pharmacy. And in terms of the work and stress, some people enjoy community pharmacist role. People like me, I enjoy community pharmacy role because I'm a people's person. I deal with patients, I deal with the public. I like to chat with the people. I enjoy community pharmacy role. And some people, they like to be introvert. They're introvert. They like to just get on with their job. They don't want to have little chats, da, da, da. And for them, hospital pharmacy is real because you don't need to discuss anything with anyone. Your patient is lying down on the bed, sleeping, and you just take the drug administration chart. You don't speak. The maximum you say is, "Good morning, how are you?" That's the maximum you say. You don't interact with them. You just look at the drug chart. You just monitor their medication, prescribe medication. That's it. You don't interact with the patients and don't interact with the public. So you just get on with your job. So I don't say one is superior, one is inferior. It just mainly depends on where your heart lies. But in terms of earning money, more or less everything is same.
All right. Thank you so much, Mr. Chiranjeevi, for answering all the questions the best possible way that you could. And I hope most of them have reached, got their essence of what today's talk is all about. And for that, and I'm also taking this pride in introducing you because you are alumni of this institute where I was when I was in 4th year of my B Pharmacy. You were in 1st year. You joined as a 1st year student. And from that day, I know you, and it's my pleasure. And today I'm very proud of you as one of my juniors, really doing a very good job in serving a lot of people in UK as a community pharmacist. I wish you all the best for your future. Now I would like our director, sir, Dr. Kumar Namani, to give vote of thanks for this session. Over to you, sir.
Thank you, Mr. Chiranjeevi, for your wonderful session. I really enjoyed it. Yeah, so pleasure is ours as well. And I'm listening to talk from the beginning to till now without a second, adding something else. Normally, I do check some WhatsApp, but today I didn't do that. I really enjoyed your talk, and few things that I learned, and I must like to inform all the participants is that in order to become a good community pharmacist, one should have a good communication skills, which I see from you today. So you want to become a good community pharmacist, you should have good communication skills. And you should connect with the patient there. And it's more of a service, and it's not a simple drugstore, which you just do for sake of earning money or profit, and you're doing a service. So you need to connect with the patient, and you need to communicate it well to the patient about the drugs. And I see a lot of pride in you in doing this job. I think, and you really like the job. You are really enjoying the job, and the way you treat with the patients, communicate with the patients, you communicate with all of us today, and there's definitely the message is passed on nicely. And I think some of the participants of today will be taking some messages from you and from talk, and take this profession as a very wide opportunity career. And one can, as you mentioned, can become an oncology pharmacologist, or can be a diabetology pharmacist, or can be community, or can do many things in whichever direction one would like to go. I think this scope is so high, and which you mentioned it very clearly. Of the few things I really touched and liked is the way you're given the examples of nitrofurantoin. I think there are many drugs which you can add to that list, like amitriptyline. When you talk about even simple indomethacin does change the color of the urine. Sulfasallians does the color change. And rifampicin is a very good example to add to this. I see some patients, because just like urine is coming like reddish color, reddish brown, and people think the blood is coming in the urine, they get scared and stop taking the medicine. And that other examples which you mentioned is an antibiotic using at the site of the issue, which is, I think these are the common issues that happen unless you communicate it well to the patient. And many miscommunication leads to the wrong use, and that leads to big problems. And your talk is the best suited to the theme of this webinar, the role of pharmacist in healthcare. I think the examples that you have given, the message you have given applies to any pharmacist working any part of the world. So I think all the participants enjoyed your talk, and I like to thank you for accepting our request. I'm also very proud of you because you are an SVCP and as an alumni of this college, and I like to welcome you when you come to the India, and you can also see our college is a huge. The campus has changed a lot. I certainly like it, and very good number of faculty is there, and there's a good activities are happening, and you can also, with your experience, with your academic training and what you're seeing in another part of the world, suggest some activities here, and we'll also try to implement in the course curriculum as well. So I'm very happy. I'm really happy today for your talk, and looking forward for your interaction with the college more and more.
Thank you.
So at the same time, I like to thank all the participants of the Zoom as well as in YouTube for participating in this webinar, and looking forward to the same interaction tomorrow as well. So thank you. Yeah.
Thank you.
Thank you, sir. Thank you for the vote of thanks, and thank you, Mr. Chiranjeev, once again for your time. And I would like to thank all the participants and those who are supporting the event from day one of this session for the role of pharmacist. And I would wish all of us to become more responsible and could achieve that. And thank you for your support. And we'll see you tomorrow for the day 5 session. Tomorrow at 10:30 a.m. IST. Thank you. Signing off, Mr. Srinivas. Thank you.
Thank you.